Hi, everyone. Thank you so much for tuning in. This is the Art of Bariatrics Bariatric Surgery Prep course. And speaking, this is Dr. Erica Lavella. I am a board certified bariatric surgeon and co-founder of the Art of Bariatrics. So today we're going to be reviewing our philosophy, and that is that you are healthier after surgery and that you have safe surgery, and that bariatric surgery is a permanent solution for weight loss and all of the medical complications that come with being significantly overweight. In our practice, we want to foster sustainable lifestyle changes that are conducive for long-term results. And that is everything that the Art of Bariatrics represents is long-term results. And how do we just help each other navigate these changes? So there's multiple causes of obesity. And remember, obesity is the medical terminology that we use to describe being significantly overweight to the point of being at risk of premature death. There are many, many, many causes of this. We have genetic influences, which relate to this, different inheritable traits that we get from mother and father, and our grandparents. But there's also environmental factors, and the environment, our exposures, different medications, how our environment is built. Do we have access to sidewalks? Do we have access to healthy food? Is healthy food affordable? All of these things interact with gene expression. Okay, if this is a new word for you, it means that our environment, what sort of chemicals do we have on board from eating and drinking, how much sleep we got, how much toxins we're exposed to, that dictates which genes are then turned on or expressed. There's also metabolic factors, and these metabolic factors overlap with the environmental and genetic factors. Metabolism is complicated, but I think science is now starting to understand it more and more. Not all of us were created equal in our opportunity to have speedier metabolisms. So there's definitely an individuality here that needs to be celebrated and honored. Microbiome. If you guys have been tuning into Art of Bariatrics for very long, you know that I am an avid microbiome teacher. And the microbiome is this internal ecosystem meaning a complex collection of microorganisms that live in our intestines. And these microorganisms that live in our intestines, they are eating the food that we eat, drinking the drinks that we drink, and they are turning that into healing chemicals for the rest of our body. So again, environment, what's going on around us, what are we exposed to, what are we eating, the microbiome processing that information and then turning it into biological chemical information that then turns on good genes or bad genes. This whole process, this interconnection, regulates metabolism and also affects our hormones. When we have hormones that are out of whack, thyroid issues, sometimes we can have too much estrogen or not enough testosterone, too much insulin, not enough insulin. There's many different hormones in the body. Hormones is how the body communicates to different organ systems. Your ovaries can communicate to your heart can communicate to your stomach. I mean, literally your brain. Because of this brain connection, it's also deemed that these healing chemicals that these gut bacteria or microorganisms make in response to the healthy food that we eat, those microorganisms then affect our psychology, our mood regulation, our ability to be more resilient to trauma. Many people who go through bariatric surgery are familiar with or have experienced some level of adversity and may or may not even carry a mental health diagnosis such as PTSD. There are many different circumstances out there that can create these feelings or these sort of memories, if you will, but the microbiome is our best defense at helping our body really process and sort of handle the stresses, changes, and situations of life that we aren't always in control of. So I get really excited here because obesity, while it may not be perfectly preventable, the whole milieu, all of these different aspects, they're so interrelated. And at the crux of the interrelatedness, the only thing we really have absolute control over is this environment piece, because the environment is the choices we make, where we live, the food choices we make, et cetera. And when we, can control what we can really optimize all of these other domains. So there are many medical complications of obesity. Remember, carrying too much excess weight, that you have some of these problems. And at the root of all of these problems is inflammation. Inflammation is what makes blood stop clotting when you cut your finger. It's what creates a hot, swollen sort of reaction from a burn. So inflammation is good and it's there to serve a purpose, but we can have unneeded or excessive inflammation. And this excessive inflammation affects every single organ system of the body. In men and women, it can affect fertility. It can affect the liver. Your liver is very important. Your liver processes all of the chemicals that your digestive system makes from eating food. Your lung function, sleep apnea, increased risk of stroke, diabetes, high cholesterol, that's what dyslipidemia means, and high blood pressure, that's what hypertension means. And then even your increased risk of cancers is also associated with being heavy. So in general, Art of Bariatrics believes strongly that bariatric surgery is an opportunity to improve all of your medical conditions. And we also foster that in order to do this, you need to learn how to eat real food. And that is part of our program, is eating real food. Exercise is absolutely imperative. You cannot have a surgery like this without the expectation that you will need to exercise. People who don't exercise are people who regain all their weight back. Mindfulness. We foster the practice of being aware of yourself, being aware of your actions, being aware of your hunger level, being aware of your need to chew or crunch or drink, so being really aware of your body and being really aware of your body's cues, being really aware of your emotions. All of these things factor into some of the mindless or behaviors that can lead to weight regain. And we start that process now before surgery. Social support. Our Facebook group is a wonderful way to have social support. Your surgery program may or may not offer a support group. If they do, we highly encourage you to take part in it. That social support is really important for accountability and also being vulnerable when things don't always go right. Stress management is also very important in mastering, lowering inflammation in the body. And so we'll talk a lot about that in our program and in our group calls. And surgery, granted you haven't had surgery yet, is just an opportunity for the weight loss that you've always kind of wanted and that your biology needs. Bariatric surgery is now considered metabolic surgery because we're literally reversing metabolic diseases. So all of these other things, the mindfulness, the stress management, the ability to exercise, the willingness or discipline to exercise, the ability to meal plan, learn a meal plan, grocery shop, make nutritious whole foods, all of that is absolutely essential in order to make surgery work for you. And also, nobody can do this work for you but you. There are many different weight loss strategies, and I'm sure many of you listening have tried them all. Restrictive eating. Sometimes this can be counterproductive because we can get overly restrictive and then we end up kind of hijacking our metabolism and doing what's called yo-yo dieting. So we need to be careful with that. There is a sort of a balance to all of this. There's not necessarily a right or wrong way to eat in regards to keto or paleo or anything like that. I think it's just most important to pick a mode that resonates most with you. And again, learn and pay attention to the science so that you can always know how to listen to your body and feed your body what your body needs. Even vegans and vegetarians out there, eventually, some of them feel the need to eat some form of animal protein. And, that's just one example of being flexible here. Excessive exercising. I know, at least I've seen this, but people will try to do, hours of cardiovascular exercise to burn a bunch of calories. The body is more efficient at weight maintenance than it is at weight loss. And that's exactly why weight loss is so hard. So while exercise is really important for maintaining a healthy body weight, you can't always exercise away all of your excess or overweightness. There are appetite suppressing medications. There are medications that also work to regulate the way that insulin functions in the body. There's some new weight loss medications that were originally developed for type 2 diabetes that are shown to intervene or act upon the same hormones that a sleeve gastrectomy does, which is, it's exciting. It's exciting to see this broader application of weight loss strategies. By no means is your use of either pre or after surgery of an appetite suppressing medication or a weight loss medication. I guess what I was getting at is we support that. If your doctor and you work through the side effects and deem that you are a good candidate and those medications can be used appropriately, all of these things are good tools. There are some experimental procedures that have been out there. I would say the lap band is evolving out of favor, at least in America, in the state that we live in, mostly because it's hard to maintain a follow-up schedule with them that allows you to get them adjusted as frequently as you need to for the right fit. Plus, sometimes they could be too tight and people end up with excessive difficulty swallowing, and it can even change the shape and function of your esophagus long term. They can also erode through the esophagus, and they only offer a sense of restriction. They don't offer any of these hormonal benefits. So there's also another experimental procedure right now where people swallow a balloon. This balloon is put in the stomach and then filled up with saline, which is basically salt water. But what happens is the stomach tries to digest it because you have this thing in your stomach. And if you aren't careful, people can have complications where they can get ulcers or their stomach can get a hole in it. And so those aren't necessarily things that we necessarily endorse either. Where I practice surgery, I routinely do sleeve gastrectomies and gastric bypasses. And we'll talk about those two procedures in detail. There are many surgery centers out there now offering duodenal switches and mini gastric bypasses. Those two types of surgeries, I am going to leave up to your surgeons to explain them to you. And if you have surgeries like that and you still want to come to us as a resource, we are more than qualified and equipped to help you with your nutritional needs after those two procedures. Those are procedures that I just don't offer to my patients, and we can talk about that later. I guess with weight loss, you wouldn't be seeking bariatric surgery if it wasn't well understood and appreciated that there's a high failure rate with any sort of dieting or weight loss strategy once your body has reached a certain body mass index. And for some people, that body mass index is 35. For some people, it's around 40. At 40 clinically, that is where you have the increased risk of all of those medical problems that we just talked about. And the reason for that is science has really observed that the body has what's called a set point. So we have a body weight set point. So bariatric surgery has evolved, and bariatric literally means stomach surgery, and it's a broad term to mean any operation to do or to deal with weight loss, which is why lap bands, and again, mini gastric bypasses, duodenal switch, all of these surgeries are kind of lumped in under bariatric surgery. Metabolic surgery are bariatric operations that induce metabolic effects. And duodenal switches and mini gastric bypasses are in this category. Sleeve gastrectomy and Roux-en-Y, which are the surgeries that I'm most familiar with, these are the most common operations performed worldwide. And the Roux-en-Y and now the sleeve also have the most literature supporting benefit, least amount of risk. So what they do is they change hormones of hunger and appetite regulation, which is wonderful. So inherently, they kind of act like a natural appetite suppressant. These hormones also affect the body weight set point. And I'll explain the body weight set point in a minute. But it helps you lose weight. It also helps you improve your blood sugar regulation. In fact, 10 years after a gastric bypass, there is a 50% reduction or 50% cure rate of type 2 diabetes, which is just a phenomenal thing for people with type 2 diabetes. So body weight set point, I think the best analogy is your body has some thermostats. There's a thermostat that regulates your body temperature. We all naturally hover around 96 to 98 degrees, and depending on infections, illnesses, for women, if we're menstruating or different times of the month, ovulation, our body temperature will change, but it is highly regulated. Your thyroid is part of this regulation. And your body fat is part of this regulation. Likewise, body weight seems to be sort of regulated in this way. And so it seems that it's easier for our bodies to gain weight, although contrary to common belief, in some individuals, it's actually hard to gain weight too. And so what happens is for every 10 or so pounds that we gain, it kind of becomes the new set point, the new programmed metabolism factor. So naturally, the heavier we get, sometimes our appetite or our need for more calories. So you're kind of biologically driven to eat more to sustain your body weight. So all of these hormones are working either for you or against you, but however you want to see it. But the body weight really is hormonally programmed. Bariatric surgery works to reset that hormonal programming, making it easier for you to lose weight and easier for you to keep it off, as long as you do the right lifestyle changes consistent with that new healthy body weight.
So
And so now we're going to talk about gastric bypass, and next we'll talk about sleeve gastrectomy.
two types of bariatric surgery here. The first one I'm going to talk about is the Roux-en-Y gastric bypass. The Roux-en-Y gastric bypass has been around for a very long time. In fact, this operation was first done to treat ulcer disease because we had to figure out a way to cut out the ulcer and then reconnect everything. So this Y, where the bowel gets brought up to where you eat, so the gastric pouch, the esophagus here, and then where it's sewn back in together, that was first invented to help treat ulcer disease. Neat, very neat. And then as an observation, oh, people lose weight when we do this. That's nice. So here we are. We're doing this operation for weight loss. We've been doing it for the primary intention of weight loss for a very long time. And I like to call what we're doing today modern bariatric surgery. Modern bariatric surgery has lots of nutritional information and the psychology support built in with it. Okay, and that is really only new within the last 10 years. So if you know anybody who had bariatric surgery beyond that, they likely didn't get this level of information prior to getting their bowels completely changed. So I think it's really important that we understand how our bowels work, the effect that surgery will have on our bowels, and the effect that the behaviors we will need to do to make sure that we're healthy after surgery are really, really important.
So the other thing that I want to add here is that there are a couple of complications that can come up after a gastric bypass that is something to be considered. Right here where the gastric pouch and the intestine meet, this is a location of vulnerability. This is where you can get an ulcer. In fact, gastric bypass patients are more likely to get an ulcer than non-gastric bypass patients. Duodenal switches, it could happen. Mini gastric bypasses, it could happen. Sleeve gastrectomies don't necessarily have an increased risk of ulcers. And what makes the gastric bypass patients more sensitive here is that the stomach tissue is never completely touching um, intestinal tissue without being buffered by digestive juices. So, in your normal anatomy, you have a liver that makes bile. That bile gets pumped out right here into this first portion here of the small intestine. That bile plus pancreatic juices, pancreas lives right here behind the stomach, pump in more enzymes, digestive juices, and those neutralize any of the stomach acid from the stomach. The majority of your stomach acid is created in the bottom half here of your stomach, but you do have a little bit from the stomach glands up here. So this is the exact reason why we tell people who are serious about getting a gastric bypass that they should never, ever, ever take ibuprofen, Aleve, naproxen, aspirin, meloxicam, any anti-inflammatory medication. So it's important that you have these conversations with your doctor. The reason we're being so explicit here is for those of you that are maybe traveling abroad to have your bariatric surgery. So these are really important things to consider. Don't take those medicines. The other thing is smoking. And in my practice, we say don't smoke marijuana, don't vape marijuana, don't smoke tobacco, don't vape tobacco. We live in a state where marijuana is recreationally legal and it is legal medicinally. We have not to date found any harm in bariatric or metabolic surgery patients who use marijuana. It's just that smoking is not preferred way to take it because smoking is associated with causing ulcers. So I know locally edibles and tinctures and things like that is the preferred way to use them. So we talked about ulcers. The other long-term side effect or risk factor is you can get what's called an internal hernia. So these red arrows and these green arrows where these bowels are sewn together, they can twist around on themselves and into a pretzel. That's called an internal hernia, but you can get a blockage. You can have nausea and vomiting. It can make you quite sick. Both ulcers and internal hernias can be a surgical emergency. So it is important that whenever you have sharp abdominal pain that doesn't get better, that you seek medical treatment right away. This is the kind of pain that'll wake you up from sleep. It's the kind of pain that won't get better after passing gas or positional changes. And with ulcers, it can hurt to eat or drink. So those should be alarm symptoms. The other thing really important here to mention is dumping syndrome. Dumping syndrome is unique to the gastric bypass. It can also happen in a mini gastric bypass, and it can, in some cases, happen in duodenal switches. It really just depends whether or not or where the bowel was cut. And again, that's a different discussion for different folks who are serious about those procedures. So dumping syndrome is where it's a paradox. So I want you to think about this for a minute. You eat something with sugar in it. Think ice cream, maybe a cookie, maybe Dr. Pepper, whatever your current sugary vice is. Think of that as being very, very, very bad for you and something you should never do after you have a gastric bypass. The reason for that is because from your mouth all the way down to this point where the green arrows are, the only micronutrient, the only nutrient you can even really absorb is sugar, carbohydrates, very simple carbohydrates. The reason for that is there's enzymes in your mouth that break down sugars, but you don't have any bile, you don't have any pancreatic enzymes, and you really don't have hardly any stomach acid. So it's hard for your body to really digest anything until it starts mixing with those other digestive juices. So those sugar can get absorbed into the bloodstream very quickly. And then what happens is the pancreas senses that because your whole body is hormonal sensing, and it overdoses you with insulin. When you get overdosed with insulin, if some of you are listening and you have type 2 diabetes and you've ever had low blood sugar, you can feel really awful. You can feel shaky, you can feel nauseous, you can feel lethargic. Some people feel really sleepy. Some people actually go to sleep and don't wake up for several hours. These are the true mechanisms of dumping syndrome, and it's related to eating sugar and then getting too much insulin to treat that sugar. Um, Working with us, you're going to learn exactly how to eat so that you can minimize those low blood sugar moments. And it's really important that you follow those post-operative nutrition and eating guidelines because you do need to eat frequent-ish meals. And I say ish because it's important that we delineate the difference between grazing and snacking all day and actually just eating 4 to 5 small meals. But it is important that you eat protein first, and then we eat vegetables second, and then we can consider whole grains and things like that. In my clinical practice, I have seen people, again, several months all the way to several decades after a Roux-en-Y. And the people who are doing the best are the people who continue to eat a whole foods diet for the most part, right? Nobody's perfect, but they do that the majority of the time, and they really avoid added sugar. I had one woman tell me that as long as it has 5 to 7 grams of sugar or less, she can eat it without dumping. So again, you're going to have to kind of try some of this on if you end up getting a gastric bypass, but it is important to note that it is a real thing that can make you just feel very unwell. Lastly, this is a newer concept, and I think this is also a very important concept, but gastric bypass changes the pH. It changes the acidification. Acid, remember we have stomach acid. It changes the pH of this part because there's hardly any stomach acid made in the gastric pouch. What can happen is that bacteria that normally grow near the colon start to creep up in the small intestine. And so, long term, after a gastric bypass, people can develop worse gastrointestinal complaints, bloating, abdominal pain, sometimes reflux or feeling overly full, but bloating and abdominal pain and just not feeling good because their bodies are so, or their tummies are so distended and painful is a lot more common than I think many surgeons give the gastric bypass credit to. And these are long-term changes. They don't usually happen right away. Your best prevention at preventing these bacterial imbalances after a Roux-en-Y are to eat fermented food and to take probiotics daily. And that is worked into the Art of Bariatrics meal plan long term. And again, where there's so many different fermented foods out there, but it really is the best primary prevention to prevent one of those long term complications. Now, I think that the gastric bypass, despite its long term risks, ulcers, bowel blockages, dumping syndrome, all of these things can be largely prevented with the right person. So don't smoke, if you can, please don't drink. Alcohol is also metabolized differently after a gastric bypass, which means you can become more intoxicated more quickly. So just be a whole breath of caution there. Not taking anti-inflammatory medications. And lastly, people with heartburn and acid reflux. So if you have significant acid reflux disease, the likelihood of it getting better with weight loss is pretty good. But a gastric bypass seems to treat it the best. And the reason for that is because at the bottom of the stomach here, it's called the pylorus, tight muscle here at the bottom. It holds everything in your stomach so that your stomach can digest it. Gastric bypass bypasses it, so the connection between your pouch and your intestine is wide open. That means when you go to eat and drink, nothing sits here for a long time and then refluxes back up. For the most part, it all just kind of slides on downstream. So I think if you have pretty bad heartburn, if you have type 2 diabetes, and if you don't do those kind of high risk behaviors, not much of a smoker, we don't operate on anybody who's smoking. So hopefully you aren't smoking either. And, not taking those anti-inflammatory medications. And if you feel really disciplined and committed to a lifestyle after surgery of whole foods, then I think you're going to be a really good candidate for a gastric bypass. These are the anatomical surgical words for these connections. So gastrojejunostomy and jejunojejunostomy. This is the site of the internal hernia, and this is the site of the marginal ulcer.
We
So this is a sleeve gastrectomy.
This is a sleeve gastrectomy. A sleeve gastrectomy is conceptually a little easier to understand. We take a stapler, we narrow the stomach, that stomach is completely separated and then removed. Whereas with the gastric bypass, we just take a little part of the stomach, kind of off the top, and we separate it. And with the sleeve, a lot of the hormones from here have just been reduced in half, right? So the stomach is hormone making. Whereas when I went to medical school, I did not know that. A lot of people didn't know that. So what we learned is that your pancreas is hormone secreting, your adrenal glands are hormone secreting, and your thyroid's hormone secreting. But we did not know that your guts are hormone secreting. Turns out almost everything in the body has some sort of hormone that it can secrete. Pretty cool. That's how everything communicates to itself.
So in a sleeve gastrectomy, one of the long-term side effects is that it has the potential to cause more heartburn, and because of the pylorus. So in the gastric bypass, I showed you that we bypass that, which means that food will freely empty into the intestines. But on a sleeve, it's still there. Plus, you have a really narrow stomach. So it's really easy to overfill your sleeve after surgery. But you can also use these internal cues of fullness, maybe a little heartburn, as a other tool to help guide your weight loss efforts. If we eat solid food and the pylorus will stay pinched closed to hold it in so your body can mix with it, or your digestive juices and gastric juices can start digesting it. If you were to drink too soon, that water has nowhere to go, it just backs up. Or if you eat even just one bite too much, it pops open the lower esophageal sphincter and it can contribute to reflux. So the surgery itself requires a very slow and methodical approach to eating and drinking, and then also being very clued in to that feeling of baby being overfull. So what can you expect? Well, 75% of your excess body weight will be lost in the first year. And I should say can be lost in the first year. Um, if you look at what is excess body weight versus what is kind of normal and healthy body weight, it's kind of a range. And for most of our patients, the average is about a third of your body weight can be lost. The average sort of literature and data suggests that greater than 50% of that can be maintained long term, so 2 to 5 years. So it is more common for people to lose a lot in the first year. And then once they hit that maintenance phase and are eating a little more regularly, a little bit of that weight can bounce back. Now, this is not true for everyone. And I just encourage people to put your health first instead of being maybe so preoccupied with the number on the scale. The weight loss is rapid though, and this is what causes the excess skin. And social media, there's some very brave men and women out there who are showing the amount of excess skin that they have. So take that into consideration. Seeing that excess skin is a marker or something to celebrate of how much weight you just lost in, hopefully how much healthier you are. And it does take plastic surgery to get that excess skin removed. Absolutely, you will see improvement in type 2 diabetes, sleep apnea, high blood pressure, acid reflux. I mentioned that potentially the sleeve can cause reflux, but likewise, weight loss is also likely to improve acid reflux. So again, have these conversations with your surgeons. It's not always a black and white, crystal clear picture. Both of these operations do come with side effects. One of the other things I haven't yet mentioned is the threat to vitamin and mineral deficiencies, which is why every program should be telling you you must take bariatric formulated multivitamin. And in our practice, we check those vitamin and mineral levels pretty often. We check them at 6 months. We check them again at a year after surgery. So make sure that your primary care doctor, please have a doctor, and that your program is checking your vitamin and mineral levels, because it is really important, especially in those bypass procedures where you can get vitamin deficiencies more readily. Weight loss, well, I think it's wonderful and we can celebrate it, especially because it lowers your risk of premature death and lowers your risk of heart disease and stroke and lowers your risk of cancer and improves diabetes and all these other things. It doesn't always improve your relationship to yourself, your relationship to others. It doesn't always result in that job promotion or your desire for a lower body weight. So if you're unhappy after weight loss surgery, um, I think that that's just a good opportunity to really reflect on why. There are complications or risks to surgery, and these are more inherent to any surgery. But I just wanted to refresh them with you in case your program isn't as thorough as we are. Bleeding can occur, infection can occur, leaks. Leaks can occur anywhere along a sleeve staple line or on the gastric bypass staple lines, and it just means there's a little micro hole. And so what you're eating and drinking can leak out. Leaks can be difficult to recover from, but the biggest thing that you can do, or the most beneficial thing you can do, is if things aren't going well, you don't feel well after surgery, that you seek help. And always go to the emergency room if you really don't feel well. Blood clots can happen behind the leg, and they can flow up to the heart. That's called a pulmonary embolism. This is why exercise is so important before surgery. And we have all of our patients walking at least 20 to 30 minutes a day before we take them to surgery at a minimum. It doesn't have to be fast, but some movement like that is going to help prevent blood clots dramatically. Heart attacks, you can get a blood clot here in any blood vessel in your heart. Another reason why exercise before surgery is really important, because if you can walk for 20 to 30 minutes without stopping, that means that your heart is going to be more likely to be able to tolerate surgery. Need for another surgery or reoperation, that is also a risk of having any surgery. Vitamin deficiencies, as we mentioned, and then lastly, death. However, I must emphasize that when you take this amount of care getting ready for a surgery, you're walking this far, right? You're starting to eat a little bit better. The risk of death is less than that of a gallbladder surgery. So do your due diligence and get your body healthy before you undergo the knife. So when you're thinking to yourself, which operation's right for me, remember there are other operations out there. It's just in my experience, these are the two most commonly performed across the country. These are the two most commonly performed in the state in which I practice. And there's not a lot of other operations that offer this benefit with the least amount of risks. These are the most well-studied and also the most likely for you to benefit from. Have these conversations with your surgeons. Do your research, talk to others who have had these surgeries. Like I mentioned, the gastric bypass, wonderful at reversing and potentially curing type 2 diabetes. The sleeve gastrectomy doesn't have data like that. The sleeve gastrectomy does a pretty good job reversing any mild metabolic disease, and both of them do a pretty good job at weight loss. You have to remember it's those lifestyle changes that result in long-term sustainable results. I have seen plenty of people, sleeve and gastric bypass, regain all of their weight back, and it doesn't take much. I mean, I saw, sometimes it's just as simple as started drinking soda again. Somebody had a knee injury, got knee arthritis, stopped walking. Literally within 3 to 4 years, all of your weight can come back if you aren't diligent. So best of luck in making these decisions. Will I be successful? I think it's just important. Again, surgery is not a tool to fix anything, or it's not going to fix anything. Surgery is a tool. Surgery is a tool is something that has been said a lot by surgeons in the last 10 to 20 years. I like to think of surgery as being an opportunity to really transform the rest of your life. It is a tool for weight loss. It is a tool for being mindful about what you're eating. It is a tool for eating less, but it's really just an opportunity to learn more about yourself and to change your lifestyle habits. The post-surgery nutrition guidelines are the instructions on how to use your tool correctly. And that is exactly what this course is about preparing you so that you know how to use your tool after surgery correctly. If you don't follow these guidelines, if you stop moving your body, if you don't prioritize protein and eating the way we're describing, if you revert back to old habits, you will absolutely regain your weight back. Your body's already programmed to gain weight more easily, and it's already programmed towards inflammation. So it's really important that you follow the guidelines if you want to be successful long term. Accountability, that's another feature here of our program. Through support groups, maybe your surgery program has one. If not, online courses like ours for both before surgery and after. There's plenty of online communities. So just stay involved and stay present, because it's a wonderful way to stay on track. Consistent follow-up also increases the success rate. So if your surgeon or program have consistent follow-up, please take them up on that. Exercise, you got to stay moving. Again, it doesn't mean you have to go to a gym. Gosh, when the pandemic hit and so many people stopped going to the gym, that's when a lot of people regained tons of weight back too. So just consistent, moderate exercise as a baseline, whatever you could do from home. That's the kind of stuff that you want to be able to maintain. All right. Thank you guys so much. We're so happy to have you here.